Did you know that despite several efforts over the years to combat HIV worldwide, the disease burden of HIV, especially in terms of prevention of mother-to-child transmission, PMTCT, during pregnancy and breastfeeding, remains a major challenge for many countries, particularly West and Central Africa and countries with a lower prevalence of HIV. Here is the new PMTCT Implementation Toolkit. The success of the PMTCT program is dependent on several programmatic factors, not only availability of tests and antiretrovirals, but the integration of services within the ANC, maternity, and postnatal care through a patient-centered approach. This approach encourages women and their families to make informed decisions about their health and that of their infant. The opportunity for their partner to be involved and be supported in the process creates greater community acceptance of HIV, which decreases stigmatization. What is the toolkit? MSF has designed a PMTCT implementation toolkit that provides you with tools and technical knowledge on how to carry out an assessment, make an order for medicine, or estimate the human resources of a project. Tips on how to design, organize, and implement integrated PMTCT services in a maternal and child health facility in terms of HR, orders, and supplies of medical and non-medical resources. Flowcharts with testing algorithms for ANC, delivery, and PNC, and how to manage patient needs based on their HIV status. Strategies and models of care to improve retention in care of mothers and their babies in the program. Strategies and models of care contextualizing PMTCT to specific situations, such as complex humanitarian settings, high ART coverage or low ART coverage, contexts working with sex workers, or contexts with adolescents, and many more other practical tools to help you implement the program. The toolkit is designed in user-friendly language with easy steps that can be understood and followed by anyone in all projects, MSF only or MSF MOH projects. It should be used in combination with existing MSF and Ministry of Health HIV clinical guidelines by all staff, both MSF and MOH. This is a tool to aid the programmatic implementation of PMTCT services for mothers, their families, and community. It is a means of eliminating HIV transmission to children during pregnancy, delivery, and breastfeeding. Steps on how to access the toolkit. The toolkit can be found on the SAMU SharePoint and is accessible using your MSF email. To access the toolkit, 1. Visit the SAMU SharePoint. 2. Click on HIV. 3. Then PMTCT folder. In this folder, you will find Implementation Tools. Click on PMTCT Toolkit, then select PMTCT Toolkit English. This folder contains 3 documents: the toolkit itself, a guide on how to use the toolkit, and a folder containing the individual annexes listed in the toolkit document. How to use the toolkit. Throughout the PMTCT toolkit, you will find download icons. The toolkit is modular, meaning that each chapter or section can be used in a fully independent manner. For icons to be clickable and open the links, the entire folder must be downloaded as a package from SharePoint. Click on the folder, then click on the 3 dots to download. Once the zip folder has downloaded, open it and extract the files to save them in your desired location. Now, when you open the toolkit on Adobe Reader, any annex selected will be clickable and the corresponding file will open. Please feel free to read and share the information with your colleagues as you set up the PMTCT program. Should you have any questions, do not hesitate to reach out to your specific HIV or PMTCT advisors in your section for assistance. Thank you, and we wish you a great mission.